So this research program is really based on the platform of our clinical care, and for over 40 years in BC we've had a clinic devoted to the care of patients with hemophilia of all ages.
In the last 3 to 4 years, looking at infusion records, which our patients are good enough to send to us to say when they bleed, when they treat. Every time there's bleeding into a joint, damage occurs, and they can become arthritic at the age of 20 years old if it isn't managed properly.
So this project was really trying to bring in the information that they were providing to us, analyze it, and then provide them with the most individualized approach to their care that we could think of.
From my perspective, I'm the physio, so I'm looking at the implication for the joints and the muscles. So people with bleeding disorders, that's the one thing, 80% of them bleed into their joints, so we're very concerned about that and making sure we can decrease and help them manage the bleeds.
We thought that we could make a difference on that. If you can prevent the bleed rather than chase the bleed, that's what we were aiming for, and we've just had great results with that.
From our research looking at individualized factor, what was important was looking how this had implications on their physical activity. So we're hoping that if we could fine-tune the factor so that they're able to do the activities they want to do, such as get to school, be able to walk from the bus stop to their job, or even sports if they're playing recreational sports or going to the gym, making sure they're able to do all these activities without having joint bleeds.
It's truly a partnership with the patients who's been with us for their whole life, and I think that's fairly unique, as well as when we talk to our colleagues across the country, it's not so easy to measure outcomes, and so it was really through the research challenge that we were able to get some traction on that and get some input from other experts in our own facility like Dr. Kemp, and really try to measure these outcomes. And it's really propelled us into the future, and we're actually getting more and more compounds or more products that are being designed for hemophiliacs, and some of them are much more longer acting. So this has really given us a system to kind of look at those future products and how they're going to be meaningful for our patients, and how to further individualize our treatment for those patients in the year or two before we start to see some of those products come to the market.